Hi guys, today let us start with the NBME 12 review. I have divided this section into orange, blue and uncolored portions. Let's start with the blue colored. Okay, yeah. This is about a UTI topic in children. If child age is less than 2 years and the episode is first also, you have to go with the RBUSG followed by VCUG, renal bladder ultrasound followed by voiding cystourethrogram. If the child age is more than 2 years, just observe if it is the first episode. If there are recurrent febrile UTI episodes, go with the definitive diagnosis RBUS and VCUG. Coming to menopause. Menopause is a clinical diagnosis. 12 months of amenorrhea under no influence of drugs like OCPs is proper requirement for this diagnosis. Don't do labs or pregnancy test, just treat the symptoms. This is a repeatedly asked topic in the NBMEs about the narcolepsy. Irresistible daytime sleepiness despite adequate sleep. The diagnosis here is multiple sleep latency tests. It does not require all classical features such as cataplexy and hypnagogic hallucinations that we read in the textbook. If any one of the features is present, then it is okay to go with the diagnosis. Coming to the orange portion, this is about the patient safety topic. Checklist and protocols improve the reliability. Preventing harm improves the patient safety. Evidence-based care improves the effectiveness. Reducing waste improves efficiency and improves lean. Respecting preferences, patient preferences improve patient-centeredness. Reducing delays improves timeliness. Eliminating disparities improves equity. This is a bit confusing and mathematical question. Just go through the explanation once. For pediatric research, consent from one parent is sufficient. When there is one existing treatment, don't add placebo to the control group. It has to be like standard plus new therapy versus standard therapy. Ophthalmology investigations. Visual field testing or visual perimetry is used for glaucoma, optic nerve disorders, idiopathic intracranial hypertension, pituitary adenoma. Visual acuity is used for refractive errors, cataract. Slit lamp examination is used to visualize the anterior segment of the eye, such as cornea, iris, anterior chamber, and lens. Alcohol use disorder. This is again a repeatedly asked topic. If there are more than two criteria in 12 months, then we can diagnose it as alcohol use disorder. The criteria are as follows: an inability to cut down the drinking more than expected, excessive time spent drinking, alcohol cravings, persistent drinking despite physical or mental problems related to drinking, persistent drinking despite negative social consequences. This is the DD between diverticulitis and Crohn's disease. Diverticulitis, usually the patient is older, the presentation is older, has older patient with history of constipation, and sometimes pneumaturia and fecaluria is given. If the same pneumaturia fecaluria is given in a young patient with a history of chronic diarrhea and weight loss, and sometimes like a perianal fistula, then the diagnosis is Crohn's disease. Drug-induced neutropenia. Stable patients are managed conservatively. Discontinue the offending drug and repeat examination in 1 week. Use granulocyte colony stimulating factors only when there is febrile neutropenia, severe infection, hemodynamic instability, chemotherapy induced neutropenia. Pre-op cardiac assessment is very important. Please go through that once. If a superficial ulcer is seen over a amputation stump, and a patient has loose prosthesis and there are no signs of infection, what is the treatment? Just pressure offloading and prosthesis socket refitting. Decision making comprises of four components: communication, understanding, assessment, and rational. Patient with dementia can retain decision making capacity. If they demonstrate all the four components, their decision should be respected. Normally, enteral feeding, there is release of CCK, cholecystokinin, and there is GB contraction, gallbladder contraction. Whereas in TPN, there is no release of CCK, so there is no contraction and cholestasis happens. And this leads to increased level of ALP. Suppose when patient ask about the complication or success rates of a certain procedure at a specific hospital, uh, the doctor has to refer to the institutional case series. The best evidence comes from this. Next, coming to the uncolored portion. If the patient has selective IgA deficiency, don't supplement IVIG, just treat the infections. There is no point in giving IVIG. IVIG is meant for if there is deficiency of IgG, but here in this case there is a normal amount of IgG, so stop thinking about this. Salivary stasis leading to acute suppurative parotitis. The risk factors are advanced stage dehydration due to dry mouth, fever, furosemide, no oral intake, stroke, anticholinergic medication such as amitriptyline, and this leads to stasis of saliva and it may lead to infection and causes acute suppurative parotitis. Painful in swelling at angle of mandible plus fever. The diagnosis is parotitis. If there is pain with meals, the diagnosis is sialolithiasis. If there is jawbone tenderness, osteomyelitis. If there is exposed bone with history of usage of bisphosphonates, the diagnosis is osteonecrosis. If renal bladder ultrasounds show hydronephrosis and renal scarring, do VCUG prior to antibiotic prophylaxis. Patient has pulsatile groin mass with intact pedal pulses and a necrotic toe. Suspect distal embolization from a femoral artery aneurysm. Surgical repair is indicated for all symptomatic aneurysms. Preeclampsia with severe features increases the risk of abruptio placenta more than the maternal death. This is about the allergic rhinitis and allergic conjunctivitis. If suppose the patient has edematous nasal mucosa and cobblestone papillae, use intranasal steroids. If in the question there is an option like simple prednisone, don't choose that. Their meaning is it is systemic steroids, not intranasal. In this question, if they didn't mention intranasal in the options, consider it as systemic. Ethics hierarchy in research. Just go through this once. Age-related macular degeneration diagnosis. We do screening with Amsler grade followed by fundoscopy with for the initial diagnosis and OCT for confirmation. Fluorescein staining is used for corneal epithelial defect. Fluorescein angiography is used for diabetic retinopathy. Ocular USG is used for vitreous hemorrhage and retinal detachment. Significant occupational exposure to HIV, start antiretroviral prophylaxis immediately within 72 hours. Don't wait for the test results. Stranger anxiety starts at 6 months and it peaks at 18 months. It presents up to 24 months. Suppression anxiety starts at 18 months and it presents up to 3 years. 3 to 6 years is the age where there is fear about the body injury and mutilation. Obesity increases the risk of SCFE, not cervical disc rupture. Leading cause of morbidity and mortality in type 2 diabetes mellitus is uh, coronary artery disease. If a pregnant patient comes after the motor vehicle accident, do ABCD same as normal person. If in this patient she has confusion and facial contusions, evaluate for neurological deficits, do CT head and neck. Rhody immunoglobulin comes later. Fever, heat increases the transdermal fentanyl absorption. It may increase the risk of opioid toxicity. In opioid pain questions, 1 to 3 is the mild pain, 4 to 6 is the moderate pain, 7 to 10 is the severe pain. If the patient presents with moderate increase in pain, increase the dose by 25 to 50%. For severe pain, directly go to the IV morphine. Ewing sarcoma should be differentiated from osteomyelitis. Ewing sarcoma usually presents with fever, bone pain, and leukocytosis, refusal to walk, and onion skin periosteal reaction, whereas osteomyelitis can have elevated ESR also. Case control study, the most important bias seen is recall bias. Post extubation, patient is obese and sitting saturation is 95%, lying in bed is 86%. This is a diagnosis of obesity related positional hypoventilation. Treatment is returning the patient to a sitting position for a while. Long-term sequelae of cleft palate even after the repair is velopharyngeal insufficiency, which is high-pitched hypernasal whistling voice. Even otitis media due to strep pneumonia is a complication. If a patient presents with suspected breast mass, hard immobile in the upper outer quadrant, and normal mammography or normal FNAC, do a excisional biopsy regardless of the results. Elderly women and thiazides are like enemies. Check sodium levels when thiazides are used in elderly women. Electrolyte abnormalities are very common. Any polyp with dysplasia, colonoscopy should be done every 3 years. DKA, glucagon and catecholamines are raised, insulin is decreased. Adjustment disorder is a diagnosis of exclusion within 3 months of stressor, identifiable stressor. Air hunger causes subjective dyspnea, treat with morphine. If there are noisy gurgling respirations from retained secretions such as death rattle, it is treated with anticholinergics such as glycopyrrolate or scopolamine. In postpartum psychiatric conditions, focus on timing of symptoms. Postpartum blues are present within 2 to 3 days of onset. They are mild depressive, likely to resolve in a week. Whereas postpartum depression, there is high risk of suicidality and loss of maternal bond with newborn. The most common causative bug in postpartum endometritis is E. coli. Opioid toxicity is determined by ABG. Skin findings are less prominent in NF2. Skin findings plus axillary or inguinal freckling. Think of NF1 and optic glioma, yearly ophthalmic examination. MRI brain is reserved for NF2 to diagnose ependymoma, meningioma, or schwannoma. If a postmenopausal woman with history of 40 years smoking and she is obese, What is the leading cause of mortality? It is cardiovascular disease. Estrogen is cardioprotective. It increases the HDL levels and decreases LDL level. Serum fasting insulin levels are not used to diagnose GDM in pregnant women with PCOS. These candidates should be screened with glucose levels early in the pregnancy, not the insulin levels. If an ICU patient presents you with the unexplained fever plus cloudy fluid is draining around the nasogastric tube and there is normal chest x-ray, think of sinusitis, do CT sinus scan. Interstitial lung diagnosis is done with HRCT and confirmed with biopsy. Common long-term complication of bacterial meningitis is hearing loss. Most common cause of death in teen and young adults is road traffic accident, accidental death. Advise use of seat belts and helmets during follow-ups. Physicians should never falsify disability forms. Instead, respectfully decline and help the patient find legitimate alternatives to meet their goals. Opsoclonus myoclonus syndrome is seen in neuroblastoma. What is opsoclonus? Rapid chaotic multidirectional eye movements. Myoclonus, it is jerking limb movements, dancing feet. Ischemic cardiomyopathy, it is more common in older patients with history of CAD. Sickle cell disease plus new chest infiltrates, it is acute chest syndrome. Obtain blood cultures and followed by IV antibiotics. Incidental ovarian cyst in an young woman plus the vitals are stable. Observe and follow up transvaginal ultrasound in 6 weeks. Most tympanic membrane perforations heal spontaneously without surgical intervention. If there is low PTH, there is low renal reabsorption of calcium and increased urinary calcium. Venous insufficiency is a clinical diagnosis. Physician dating current patient is always unethical. Sickle cell disease increases the risk of complications from traumatic hyphema because sickled erythrocytes obstruct aqueous outflow and rapidly elevate intraocular pressure. When you see trauma, bowel perforation, fecal contamination, or succus entericus, think of delayed primary closure, that is, close fascia but leave the skin open. This is tertiary intention. Dijot syndrome features are non-specific. They may overlap with Down syndrome, and the features are low set ears, hypertelorism, micrognathia, cleft lip, and palate. Autism spectrum disorder is also known as pervasive developmental disorder. Subarachnoid hemorrhage. If NCCT is negative, do CSF analysis. Thompson test is used to assess the integrity of Achilles tendon. If the test is positive, it indicates rupture of Achilles tendon. Go for surgery. Men who have sex with men, they are at risk of hepatitis A. Give hepatitis A vaccine. Strongest predictor of poor prognosis in pancreatic cancer is unresectability due to local vascular invasion, especially encasement of the superior mesenteric artery or other major vessels. Basal cell carcinoma does not tend to metastasize but can spread locally. Multiple myeloma is confirmed by bone marrow biopsy. Thank you.